How do glaucoma surgeries target eye drainage pathways? Imagine your eye as a tiny, busy water park where fluid constantly flows in and out to keep everything balanced. In glaucoma, this flow gets blocked or slowed, causing pressure to build up and risking damage to the optic nerve. Glaucoma surgeries are like opening new pathways or fixing the existing ones to let that fluid drain smoothly again. The main goal is to lower the pressure inside the eye, called intraocular pressure, to protect your vision. Inside the eye, the fluid called aqueous humor is produced all the time. It nourishes the eye and helps keep its shape. Normally, this fluid flows out through a spongy tissue called the trabecular meshwork, located at the angle between the cornea and iris. From there, it passes into Schlemm's canal, a circular channel that acts like a drain, then into tiny collector channels, and finally into the bloodstream. When this drainage system gets blocked or resistant, fluid can't exit properly, causing pressure to rise and potentially damaging the optic nerve. Many glaucoma surgeries focus on fixing or bypassing these natural drainage pathways. One common approach is to remove or make an incision in the trabecular meshwork. This helps open up the main site of resistance, allowing the fluid to flow more freely into Schlemm's canal and beyond. Some procedures involve unroofing Schlemm's canal itself, which means exposing or enlarging it to improve fluid access. By doing this, the eye's natural drainage system works better, lowering the pressure inside. There are also minimally invasive surgeries, often called MIGS, which use tiny devices or stents. These are implanted into the trabecular meshwork or Schlemm's canal to help bypass blockages or narrowings. MIGS procedures are less invasive, often requiring less recovery time, and have fewer risks compared to traditional surgeries. They are especially useful for mild to moderate glaucoma cases. Another approach is creating an entirely new drainage route. These surgeries divert the fluid to a space beneath the outer membrane of the eye, called the conjunctiva. This forms a small bubble or bleb where the fluid can be absorbed, effectively reducing pressure. While this doesn't directly fix the natural pathways, it provides an alternative way for the fluid to leave the eye. Some surgeries also target the uveoscleral pathway, an alternative route where fluid flows through the ciliary muscle and out through the sclera, the white part of the eye. Although less common, some treatments aim to enhance this pathway, especially when traditional drainage routes are severely blocked. Choosing the right surgery depends on the type and severity of glaucoma, the eye's anatomy, and overall health. These procedures are designed to address the core problem of resistance in the eye's natural drainage system. By improving or bypassing these pathways, surgeries help lower intraocular pressure, protect the optic nerve, and preserve vision. It's important to remember that all surgeries carry some risks and requiring careful planning and follow-up care. If you or someone you know is considering glaucoma surgery, consulting a qualified eye specialist is essential to determine the best approach tailored to individual needs.